What's up, everybody? Dr. Noel here, board certified veterinary radiologist. So, on the last episode, episode 5 of Report Pending, we had a case of a heart-based mass, and there was also some pulmonary nodules overlying the cardiac apex. And we had a second-year vet student, Grace, at a UC Davis, that had a question in an email, and I thought it would be worthwhile to address this, as other people may or may not have the same question, but I think it offers a useful learning opportunity. So one of the questions that she had was essentially trying to differentiate osseous metaplasia, which is also called heterotopic bone in the lungs, versus pulmonary nodules. There are some criteria that I will use in order to diagnose one or the other, or certainly to increase the chances that I believe one is more likely over the other. So pulmonary osseous metaplasia, they tend to be small 1 to 3 millimeter mineralized nodules, and they all tend to uh, have uniform size. So this is the case that we discussed with episode 5, and there's a cluster of pulmonary nodules overlying the cardiac apex on the this lateral view. So you'll see them right here. So without going into the entirety of the case, I suspect that these are soft tissue opaque pulmonary nodules and they're metastatic. And the reason is in clear distinction from osseous metaplasia is that they are variable in size. So they're soft tissue opaque and they're variable in size. So a lot of people, and it's been my experience as well, that a round soft tissue opaque nodule tends to become conspicuous on radiography only when it hits about 4 millimeters in diameter or larger. And so if you have a very small 3 millimeter, 2 millimeter sized nodule and you're seeing it, it's either an end on blood vessel or it's mineral. So it's actually attenuated more X-rays, more photons than the soft tissue nodule. And so the other thing that I'll show you on heterotopic bone is heterotopic bone. They tend to be uniform in size. And so they can be a little bit of variability, but you see in these, they're kind of different in size. This one's bigger than that one, and that one's a little smaller. So metastatic disease tends to be variable in size. And then let me pull up the heterotopic bone. So you'll notice there's just like a peppering of these lungs, and they're very small nodules. Okay, so heterotopic bone, they can get a little bigger than this, but what you'll notice is that all of these little nuggets are fairly similar in size. So the only reason that you can see these is because they're mineral, so they're attenuating more X-ray than the soft tissue nodule. The other thing is Shelties and collies tend to have a predisposition for these, and it's been my experience, and it's been reported as well, that they love to have a distribution in the cranial and ventral aspect of the lung. So the last case, I think, are probably Mets because they're larger than 4 millimeters. They're variable in size. These are heterotopic bone or osseous metaplasia because they're uniform in size. They're quite small, certainly under 4 millimeters. They tend to localize in the ventral lung, though they can be everywhere. And if you have a Sheltie or a collie, this isn't either, so it doesn't have to be those dogs, but it tends to be a predisposition for those dogs. So heterotopic bone, osseous metaplasia, we don't care about it. These are not osteosarcoma Mets. These are a no touch or a gee whiz kind of finding, and should not be confused with pulmonary metastasis. So I hope that answered your question, Grace, and I'll talk to you guys soon. Thanks.